So basically, my first question is, what's the number one thing that people should be doing if they're feeling symptoms related to COVID-19 or just, respiratory illness symptoms as well?
Yeah, so if people are feeling unwell and feel that they need to access care, I think the most prudent thing for everyone to do is first to call their local health centers to access care through local care providers that they know and trust. There are health authority lines as well that every community member will have access to, as well as provincial lines, including the nurses 811 line. And there's a special COVID line that's also been created. So there are multiple pathways for people to reach out, but the fundamental message is to avoid the temptation to go somewhere else beyond where they physically are at that time. So if you're at home, the priority should be to stay at home and to access care in a way that's different than perhaps previous, where maybe I would go to the local health center, jump in the truck, walk down the road, get a ride to the local health center. In the time of COVID-19, that's a potentially lethal move, okay? So the priority needs to be access care through the telephone, through video, that if at all possible. I totally recognizing that there are always exceptions and not everybody has access to technology, even a telephone.
Right. And then kind of on that note, what should be the very first thing someone should do if they suspect they have come into contact with somebody with COVID-19, or if they have traveled recently, anything like that? What should be the very first thing they should do?
Yeah, so I think this all comes, the messaging is going to be pretty familiar, and I'm going to end up repeating myself over and over again. But I think if we go back and think about COVID-19 is a pandemic throughout the world, okay? So this is an infection, this is a virus that is doing great harm all over the world, and that we see in the media every day. And in Canada, we've been later to receive the arrival of COVID than, say, countries like China or Iran or countries in Europe. But the foundational principle of how COVID is spread helps to answer your question. So COVID is spread from people to people contact. The chance of spreading or contracting COVID is directly proportional to how much person-to-person contact happens. So the more somebody can isolate themselves within their home and avoid unnecessary travel away from their home, the less likely they will contract COVID-19. So when someone feels they're either coming down with something that they're not sure what, or they suspect perhaps they've been in contact with somebody, the same rules apply. Don't go anywhere, stay where you are, and call, and you will get help. One of the great things in the Carrick County Family Services Network is that over the last 10 years, we've established a very robust network of virtual healthcare practitioners as well as technology. So care is accessible, probably more so now than it ever has been. It's just that it looks a little differently than what it did a few months back, where again, you might just head to the local health center. So now the fundamental principle is don't go anywhere, call, ask for help, be brought to help can come to your home. And just like we're doing this video call now, I've been doing video calls to patients in their homes now for the last few weeks, and there are more so, and I'm doing telephone calls, and it really helps to minimize the need for anybody to leave their home, because home is a safe place. That's the safest place we know. Going out into the public, going to waiting rooms, stores, that kind of thing is much riskier activity.
Right, right. And then what would define an emergency that you should go, to the emergency room or, call 911, anything like that?
Yeah, I think the same things apply if someone's having symptoms of any kind that are truly potentially life-threatening. They're short of breath. They're having trouble breathing. They have chest pain that is unrecognizable to them. Those kinds of things. They should access the healthcare system through the usual channels. They can call 911. They can ambulances can be dispatched to come and take them to a hospital. So those same rules apply for those patients who are in distress.
Okay. And is there any, kind of over-the-counter medicines or remedies that you might suggest that people could use that are experiencing symptoms related to COVID-19? Like I was watching a CTV report that said only use acetaminophen as opposed to ibuprofen, and I'm just wondering if you have any suggestions.
Yeah, I think the really important part of your question is that to remind everybody that there's no cure for COVID. There's not an antibiotic. There's not an antiviral medicine. There's no pill that doctors or healthcare providers can give patients with COVID to get rid of it. And that's really hard for everybody. Okay. Because as doctors, we want to make people better as quickly as possible. We want to give them medicine that's going to make them better. In the case of COVID, it's really about conservative management, meaning it's try to take the best care of yourself during this time of the illness. And the illness ranges, as you know, from people that they may have no symptoms to very minor symptoms, to those that have quite a bad cough and a fever, to people that are profoundly short of breath, and there's everything in between. So good hydration with fluids, good use of Tylenol. I personally haven't heard the discrepancy between Tylenol and ibuprofen, but it is a general rule that if there's any chance of being dehydrated, Tylenol is a much safer option for people to take while they're ill. Okay.
Okay. And then kind of to top it off, what are some things that we can do to support the more vulnerable people, such as our elders?
Yeah. So I think the first thing is for everyone to understand that we're all in this together. This is a worldwide problem. There's no person on the planet that is out of harm's way here with COVID. So we're all in this battle together with the COVID-19 virus. That means we need to keep strong collectively. We need to support each other. We need to keep our spirits high. We need to, one of the advantages of technology is that through interacting on social media, we can say positive things and really encourage and communicate with one another in ways that weren't doable before. I think for elders, regular check-ins with elders is really needs to be a fundamental part of our daily lives. So we should be checking in on elders. People who are the most vulnerable need to be looked in on. Some communities are providing meals, and they can deliver them to the doorstep of an elder. And through technology, people that are well can come to support an elder, and someone like myself can see the elder in their home to support them, ask and answer questions and that kind of thing. But I think our elders are, without question, the most vulnerable people to COVID-19. We know that. And so minimizing their interaction with people will help minimize their risk of contracting COVID. So people who do go visit elders need to ensure that they are symptom-free, that they have no risk factors themselves from recent travel, or somehow have been in contact with anybody who might have contracted COVID-19. So I think good social support for elders but for all the community members is so greatly important in this really stressful time. It's stressful for everyone. There's a lot of anxiety. There's a lot of unknown. We're facing a challenge here that none of us on this planet have ever faced before. It's unprecedented territory that we're all in.